Hi, my name is Jason Seaton. I'm a physiotherapist. I'm here to talk to you today about anterior knee pain. What is anterior knee pain? Anterior knee pain is basically pain at the front of your knee or around the kneecap area. It can affect both boys and girls or males and females, but it affects females or girls greater than it does the boys or male gender. It's greatest at puberty, but it can affect any age, but puberty is usually the key area. And this is because, particularly with females, you start changing, your pelvis gets slightly bigger, and you start putting a bigger stress coming down into the knee itself because of the shape and the direction of force that goes through the leg. It can also cause pain, not just at the front of the knee, but also around the sides of the knee. It can also could be at the front and the top and the bottom parts of the kneecap. And it can move around, and it can make diagnosis very difficult at that stage because the pain is moving around in lots of places. It can also refer pain down the shin and also down to the ankle, which can again be confusing to a lot of people. The pain is mainly caused because of maltracking of the kneecap, so the kneecap is being pulled to the side, and this causes some irritation to the cartilage, but also to the soft tissue around the knee. The cartilage underneath the kneecap is the thickest part of cartilage in the whole of the body, and it's like a sponge, and when it squishes down because of the tension created by the muscles on the outside of the knee, it irritates that and it tries to relieve it, and it stretches the soft tissue around, causing your pain. So what are the causes of anterior knee pain? Well, there are many causes to anterior knee pain. The main ones being weight. So obviously if you're overweight, this is going to put excess stress through the joint, particularly around the kneecap, and particularly through the knee joint itself. The other ones will be poor muscle control. So we have your big glute muscles around here, so the bum muscles there, and they help to stabilise that pelvis and stabilise the rest of the joint. If those glute muscles up around here aren't working effectively or controlling what you should be doing, what will happen is it will put stress going through the outside edge of your leg, going down to the outside edge of your knee. Your kneecap will then pull to the side and it will irritate it, and that will then generate your pain. Also, if these muscles aren't firing or working as well as they should do, there's a muscle at the front of your hip around here. It will cause your ITB, which is down the outside edge of your knee there, to tighten up. And the ITB is the iliotibial band. If that tightens up, it blends into your quadricep muscles, which are over the top. That attaches to your knee, and again, that will pull it out to the side, and that will cause further irritation. This also leads us to tight muscles as well. So if we think of the hamstring muscles, which are at the back of your thigh, and your calf muscles at the back of the lower part of your leg, if they're tight, it stops you from using that leg effectively. You use a smaller stride length, which means you don't use your glutes as much, and again, that will generate more problems for you. Overtraining is a big one we see, particularly in sports people, and particularly in runners, particularly when they're training for a marathon as well. And we tend to find that people, particularly novices who want to do a long distance run, they start off with their short distance and all of a sudden they jump big distances in one go. And that puts a lot of stress on this ITB on the outside, again causing this traction over the outside of the knee, and it rubs on the outside edge called iliotibial band friction syndrome, and it causes this irritation and a lot of pain, and it stops them from doing their activity. The other ones will also sort of decrease balance, or what we call proprioception, which is the awareness of what your body or your joints are doing in space. If we have this poor balance on here, the joint doesn't know or recognise what you're doing or how you should be doing certain activities, and that will then create greater problems around the knee again. We also have trauma, which is an obvious one. If you get knocked, particularly on the inside edge of your knee, such as a tackle or a blow from a martial arts type action, this will then cause the knee to maltract or can dislocate or partially dislocate, known as subluxation, and it can rupture a ligament on the inside edge. This ligament helps to maintain the knee in its position, and if that's ruptured, your kneecap will be susceptible to glide into the outside edge, and that will cause further irritation. And that can be quite hard to kind of reposition that knee and to control it. Over time, if you strengthen those muscles, that should recover itself. The final one, which we've mentioned before, is gender. And we already know that females or girls are much more susceptible to knee problems than boys, mainly because of the biomechanics and because of the hips tend to be at a slighter angle, a bigger angle for them compared to boys. Boys tend to have straighter legs and have less stress going through the joints. Okay, so what are the signs and symptoms of anterior knee pain? Well, it can be quite varied, which makes the diagnosis for anterior knee pain quite difficult. But the most common ones are usually a gradual onset, but it can also be a sudden change of events, such as we've described earlier, you've increased your training regime, or you've done more activity than normal, or also trauma, but usually it's a gradual onset. There can also be some locking, but we call this pseudo-locking, which is kind of false locking. So it's where the kneecap is just slightly maltracked, and what tends to happen is it doesn't fit in the groove that it should be fitting into, and you go to straighten the leg and it just feels jammed. You gently move the leg back into full extension, and it clicks back into position, and all of a sudden your movement is back. Or you rest it and it settles and it returns back to its normal range. There can be an occasional swelling, but this is not always a common thing, but swelling can be an issue and it can be there. You may also get some giving, and this is usually due to pain, or it can be due to muscle inhibition, where the muscle isn't quite strong enough to support you and the leg feels as if it's going to buckle. The last couple of things are usually you have pain around the actual kneecap area itself, but it can move. And again, that can be confusing for the patient because you kind of feel pain in one place, then it's another, and it makes it hard for you to then pinpoint where those symptoms are. And the last one, which is quite a common one we see a lot of, is where the kneecap is grinding or clicking, particularly when you're bending, squatting or kneeling. So what aggravates anterior knee pain? Well, there are a few factors that are quite common and we see a lot in our patients. The first one is usually stairs. A lot of patients tend to find going up or coming down are their main problems. Usually up kind of affects into the kneecap itself, whilst coming down the stairs tends to affect the tendon at the front of the knee. The next ones are usually sitting, and a lot of patients get confused with this because they feel that when they're sitting they're not doing anything with their knee. Unfortunately, when you're sitting, and particularly when you're driving, your knee's at such an angle, when it's in this angle here, it puts stress going through the outside edge of your knee, and this muscle on the outside tightens. And it's at its greatest point when your knee is at a slightly bent position, particularly when using the accelerator or using the clutch. As it tightens, it pulls your kneecap across, it compresses this cartilage that we spoke about earlier. That cartilage then wants to spring back out and it irritates the soft tissue around it, creating your pain. Similarly, it will do the same sort of thing when you're sitting, either watching the telly or when you're at the desk doing some work. We also have squatting, which is again is a common one, particularly when you're sitting or standing up from a sitting position, or when you're sitting or going to sit down onto the floor or squatting down onto the floor. A lot of people feel they can feel some pain, discomfort and that grinding sensation into their knee. Impact is also another big cause to some of these pains, particularly when you're doing running or even just walking where it's low impact. But it's that impact going through the joint, and it's the ability for the muscles up here to control that pelvis and to stop the knee from dipping inwards, creating tension through the outside edge of that knee and through the muscles here, causing that knee to maltrack out to the side. Another common one is lunging, particularly when you lunge and the legs at the back. And it's a similar sort of position when you're on a cross-training machine. When you're kind of cycling through that motion, the leg comes back into that position, and again it creates increased tension on the outside edge of your knee, the kneecap maltracks again. And the final one that we tend to see a lot of is kneeling. When you're kneeling down, putting direct pressure onto that kneecap, and the kneecap wants to maltrack to the side because it's being compressed and pushed over. So how do we treat anterior knee pain? Well, to start off with, if it's very acute and very painful, you need to get that pain under control. If you don't, you're going to compensate, you're going to cause muscle wasting, you're going to reduce your range of movement, you're going to have poor function, and you're going to start having abnormal movements which is going to make your pain worse. So your GP will prescribe you appropriate medication, whether it's anti-inflammatories or painkillers. You must take that as he's prescribed, otherwise only doing small amounts of it won't give you the desired effect, and you'll still be going round and round in circles and not really having any desired effect of that pain relief that you're looking for to allow you to function normally. Once we have that pain under control, then we want to then move you to kind of correcting the main cause of your symptoms. Remember, pain relief is only a temporary measure. It doesn't correct or actually deal with the cause of your symptoms in the first place. Remember, the cause of your symptoms are a mechanical problem, usually the muscle wasting, muscle weakness, or poor biomechanics. So correcting that is using specific exercises. Whilst you're doing your exercises, you might find it is painful. and that will put patients off from continuing with their exercises. And again, it's important to stay on top of your medication, to keep on top of that pain. If you don't, you're going to fail to do your exercises and you're going to fail to resolve your symptoms around this knee. You must do these exercises on a regular basis. If you only do them once every now and again, you're not going to get that desired effect. You're not going to get a carryover, you're not going to get an increase in strength or an increase in muscle length that we're looking for to correct this problem. So make sure you do these exercises for the prescribed period. If you do it slightly shorter than that, you might just fail short of actually recovering from this problem, and you might find a few weeks after stopping the exercises, the symptoms return. So how do you prevent this from coming back? Well, once you've finished your course of exercises or your prescribed program, you want to then try and fit in on a regular basis, once or twice a week would be great, just a stretching and a conditioning program. And this will usually be recommended via the app.